allowing space for patients to vocalize that is a big part of helping them deal with some of the things that they've got going on.
Absolutely. Absolutely. And there's a lot of spiritual bypass that happens in the psychedelic world. And again, being raised by Soviets, I have just a different approach to things that really pisses some people off and others love it, you know. But I had a patient once who for her she was doing MDMA assisted therapy to work on childhood sexual trauma. And it was so clear to me and her therapist that she had just done leaps and bounds of progress after her MDMA therapy session. And at one point in her appointment with me, like a follow up, she got frustrated and she goes, yeah, but I don't know. I think I needed a higher dose. I'm like, why do you feel like you needed a higher dose of MDMA? It's clear you got like benefit out of it. She goes, yeah, but like, I know I'm supposed to go to this, like, I know I'm supposed to reach this point where I feel like the trauma was a blessing. And yeah. And like, so here's the thing is when your parents are from like Ukraine, Russia, and Moldova, you say things like, where'd you get that stupid idea? Like, she thought that that's what the goal is, that the goal of treatment is to get to a place where you see it all as perfect. Everything happened as it should have. What a blessing that I was repeatedly raped by my foster family father. You know, no, it can be that. It is that for many people. And how wonderful for them. It doesn't have to be that. And if you don't get to that place, you've still done a lot of healing and growth, and you still get to have an awesome life. You don't owe anybody your forgiveness. You don't owe any experience your acceptance. There's still a way to integrate it into your psyche and in your body and in your nervous system that lets you go ahead and have an awesome life, even though that horrible thing happened.
I think it just goes to show that even with psychedelics, there is no one size fits all. And we keep trying in our Western model to push people to a one size fits all, and it's just never going to work. And when are we going to learn